attending remotely. So in this fellowship, we've had these 10 fellows doing research over the 1 year long period. We've had them being mentored. Every week they are working with their mentors. Again, these are professors, faculty from quite a number of departments. They have also been attending monthly workshops. They have attended monthly journal clubs where they discuss issues, contemporary issues affecting society, affecting health and equity of people, but also related to COVID-19, as we know that COVID-19, the pandemic, has been an issue. So for those of you who just joined in, Dr. Joseph Bionanebie, a clinical assistant professor in the Department of Biomedical Sciences. I'm a clinical assistant professor who focuses on public health, global health, epidemiology, and I have been the director for this fellowship program. I've worked closely with a team of professors and mentors. You will get to know them as we go along. My duty is to welcome all people who are attending this session. I know we do have some family members that are listening in with us, family members of the fellows, their friends, their workmates. We have been faculty from quite a number of departments and from some other universities. We have university leaders attending this session. I can see Dr. Jean Hosen already present, Dr. John Su. Dr. Jean Hosen she'll be introduced later. I don't want to spoil the story. You know, the Vice President for Innovation and Research here at Marquette University. And you'll get to know more of them as the session goes on. We have our keynote speaker from MCW, Advancing Healthcare Wisconsin Partnership. We have quite a number of faculty here. So without wasting more time, Dr. Neil, are you available? The program will be run by a number of faculty, Dr. Nilanjan Lodi, Dr. Alexandra Martins, Dr. Samina Moore, Dr. Sandra Hunter. We like working as a team. Dr. Neil, I'll move forward to respect our time. Kat, if you can move forward the slide. Most importantly, we want to recognize our fellows for today. We have Brian Webie, who is from Exercise and Rehabilitation Science. We do have Casey Library from Biomedical Sciences with a minor in Public Health and Equity. We have David Rock from Biomedical Sciences, but also doing, I think he's doing his master's in exercise rehabilitation. We have Dina Natkunda from Clinical Mental Health Counseling. She has an MBA in multi-healthcare management. We have Emily Beltran with a Bachelor of Science in Psychology and Biology, doing her master's in nursing. We have Emily Effington, also from nursing. We have Julia from biochemistry and molecular biology. We have Karina Miller from clinical laboratory science. We have Madeline Gwynn from biomedical sciences with a minor in public health and equity. We have Natalie Rowe from biomedical sciences. As you can see, it's a huge team. It is a huge team from quite a number of disciplines. If you can move forward the slide. Now, I have another pleasure to introduce to us their mentors, beautiful faces, professors and faculty from, again, quite a number of departments. Dr. Mary Bement was a mentor for Brianna. Dr. John Mantz, who has been a chair from biomedical sciences here at Marquette, and now a chair of pharmacology at MCW, has mentored at least 2 students, Casey and also Madeline. We have Dr. Sandra Hunter, who has mentored David. We have Dr. Alexander Martins, who has mentored Dina Natkunda. We have Dr. Dola Clayton-Jones, who has mentored Emily B. We have Dr. Abiola Kayla, who has mentored Emily Effington. We have Dr. Elizabeth Angeli, who has mentored Julia. And then we have Dr. Neil Lodi, who has mentored Karina Miller. We have, again, Dr. John Mantz has done a wonderful job. He's one of the initiators, the brain behind this fellowship, whom we worked with from the start, from the beginning, and he continues to support us wherever he is. And he has also mentored Madeline Gwynn. Dr. Joseph Bionanebie, the one who is speaking, they prefer to call me Dr. B, has mentored Natalie Rowe. So we are here to learn about their work. Could move to the next slide. Dr. Samina. Dr. Samina Miller, are you available?
So Joseph, do you want me to start right now?
Yes, Dr. Samina was to kind of give a brief introduction of who you are. Dr. Jean Holsenberg, she's the Vice President for Market Research. You are welcome to move forward this agenda. Thank you so much.
Thank you, Joseph. I am delighted to be here. As Joseph noted, I am Jean Hasselhoff. I'm Vice President for Research and Innovation at Marquette. And I've been watching this community of practice evolve since the faculty came together with this initial idea that to live out Marquette's mission at its best, we needed to come together across disciplinary boundaries and think about the needs of the underserved and marginalized in our community and in the world. And to think about this from the perspective of how do we integrate people from different disciplines, teaching activities, research activities, and community engaged work. And so this group has really come together around a number of significant initiatives. Through University Way-Klingler teaching enhancement, they generated a multidisciplinary minor that currently serves 27 students on campus at the undergraduate level. In partnership with the Medical College of Wisconsin, there is now an ADP master's program in global health equity. And 2 of our fellows from today will be enrolling in that program in the fall. So we're really excited about this bridge from Marquette to the global health equity work at MCW. And the thing that pulled me into all of this was that the group also successfully competed for an Explorer Challenge Award. This is our annual University Innovation Fund competition that's open to any student, faculty, or staff member on campus. And when we review Innovation Fund proposals, we look for innovation, of course, and we have a very broad definition of what that means. We look at the potential for impact. And as we have evolved the program, we are also now requiring people to deeply embed inclusive practices in their projects. And so I think the work today is a great example of the impact of the way we've set up the Innovation Fund. Now, the funding was given before the pandemic hit. And what ended up happening is the initial objectives that the team had set out to meet could not be done because of the circumstances of the pandemic. And that required the investigators, the lead faculty to really think about how could we adapt to the world around us, to the very clear need to be thinking about and working on public health and equity in a time of pandemic. And so they came to me and said, would it be okay if we changed what we were doing a little bit and create this fellows program? And that's exactly what we want to see our innovators do, to respond to the challenges of the time and to create opportunity that allow us to work together. And so I am deeply grateful to the faculty, to all of the mentors. This has been a year where we know that you have all had additional things on your plates to handle, and the time that you spend mentoring students is so critically important. I am grateful to the students for their effort and dedication to this. I love the fact that this is also a program that has graduate and undergraduate students together in community. That's a great example. There are very few multidisciplinary research communities on campus that really kind of reach across scholars at all levels. And so this will be an example for others on campus as we go forward. And of course, none of this work can be done without partnerships within the community. And also with our frequent partners at MCW on a number of initiatives. So I look forward to seeing what you've all accomplished today. Congratulations to the students for persevering during these challenging times to work on your projects and move this forward. And I look forward to what the next great outcomes of the community of practice in public health and equity will lead us. Thank you.
Thank you, Jean. And next we have our keynote address from Dr. J.C. Enfield. Dr. Enfield is the Director for Advancing Healthcare Wisconsin Partnership, and he is the past chair for the American Medical Association, the Board of Trustees. Dr. Enfield, we are glad to have you here to speak to us.
Well, thank you for having me. As was mentioned, my name is Jesse Ehrenfeld. I'm an anesthesiologist, practiced at Frederick and the Medical College of Wisconsin. I'm still a trustee at the AMA, and most relevant to our time together today, I'm a senior associate dean at MCW and the director of the Advancing a Healthier Wisconsin Endowment. What is the Advancing a Healthier Wisconsin Endowment? We're a $525 million statewide philanthropy that's based here at MCW. And we have a really unique story and a huge mission. And so I'd like to take a couple minutes to tell you about what we're working toward and why we need you to keep the lessons that you've learned through this program alongside as you move forward with your careers. So HW is unique. We're one of more than 300 health conversion foundations that exist across the country that were formed by a nonprofit health organization converting to a for-profit company. And HW was established when Blue Cross Blue Shield of Wisconsin converted, and the proceeds of that stock sale were required by the state of Wisconsin to be distributed to the state's 2 medical schools to create 2 endowments that would be available in perpetuity to improve health statewide. So while there are more than 300 health conversion foundations that exist nationwide, we are the only one that we're aware of who steward public funds, in that these funds were given to MCW on behalf of the people of Wisconsin from within a private institution. And our mission and our focus on stewarding these dollars for Wisconsin is what drives us every day. And we've got a big goal, and that goal is to make Wisconsin the healthiest state in the nation. And we're working toward that goal by investing in work that will improve health and advance health equity. And I'm glad that the new master's program in global health was just mentioned, because on the MCW side, the endowment funded the development of that curriculum. And so that's really what I want to talk to you about today, equity. What I hope you'll take away from your experience is that while the need for equity is talked about all over the world right now, equity is not just a buzzword. It's not a checkbox. It's a principle that's got to be woven into the very fabric of who we are and how we think and what we do as individuals and as a society. And your work in this space, how you incorporate the principles of public health and health equity into everything that you do is critical. Actually, it's more than that. It's essential. It's essential to the health of our community here in Milwaukee. It's essential to the state, and it's essential, frankly, to the future of our country. Now, in Wisconsin, you all know as well as I do that we face some of the most significant disparities in health outcomes in the nation. Right here in our backyard in Milwaukee, there are prime examples. We live and work in a city where the infant mortality rates are on par with those found in the developing world. A city that's been highlighted nationwide for our history and continuation as one of the most segregated metro areas in the nation. And nationwide, you know, the US offers some of the best medical care in the world, yet we have some of the most unhealthy people in the developed world. And when you dig into the data, and when you pull out data by race, by ethnicity, by sexual orientation or gender identity, we find data and health outcomes that should be unacceptable to anybody. And the pandemic has highlighted these inequities and frankly deepened them. And in my daily work, I'm reminded of this. When COVID-19 first arrived in Wisconsin last March, we as a philanthropy knew we had to respond. And we did that. We released more than $4.8 million. We funded 17 projects last April to do work statewide. Those projects had a particular focus on the most vulnerable, marginalized, and underserved populations. We funded work to reach out to migrant and seasonal agricultural workers, Hmong-speaking populations, transgender individuals, those who have difficulty accessing healthcare. And our funding is continuing to reach populations that have been most impacted. We just announced an award last week to a coalition of groups in Milwaukee County to focus on trying to do COVID-19 vaccination awareness and outreach in the 10 most impacted and underserved zip codes. And I'm really proud of that work. I'm proud of the almost $85 million that we've invested in communities across the state. 71% of those dollars have gone to the counties with the poorest health outcomes. But I know that even while many of those projects are creating changes to the policies and systems that impact health and creating positive impacts in the community, we're still just at the tip of the iceberg. That is how deeply rooted these issues are. But I'm not disheartened because every day I see the good. I see the projects, the ideas, and the enthusiasm that comes to us in philanthropy from people like you who are striving to create the change that we need. And in these proposals, you know, I always look for the ideas that will take small steps forward alongside the ones that could lead to big change or big wins, because there have been and will always continue to be big wins in this work. But most of the time, they come from accumulation of those small steps, the everyday work that drives us forward. So today, as you all move forward in your studies and your work, I hope that what you take away is a deep conviction and a focus on the bigger picture and the reality that every bit of work you do will push forward things in a way that matters. And I hope that your work in this fellowship program and what you see around you here in Milwaukee, in Wisconsin, in the US, lights a fire in all of you. And so with that, let me just say congratulations on what you've accomplished. Thanks for having me. I look forward to hearing about your work and your projects through the rest of the program. And I hope that we can stay connected. And if there's anything that I can do to support you in my role at MCW, and through the endowment, please let me know.
Thank you so much, Dr. Enfield. Dr. Alexander Martins.
Yes, thank you, Joseph. Thank you all for being here with us today. I am Dr. Alexander Martins. I'm professor at College of Nursing and in a joint position College of Nursing and the College of Arts and Science. And I am very happy here to introduce the students had been introduced already, but I'll just call them now to start the presentation. I will follow the list you can see there. Me and my colleague, Dr. Karina Miller, you do that. So I'll introduce the first 5, and then she will lead the other, the second half of the group. So I will call you in that list. You students have 5 minutes to do your presentation. I will be very strict with time. When it's 4 minutes, I will just say like 4 minutes, and then means you have 1 minute left. Okay, just to give you a warning. But thank you again for all that great work you have done. So I hope you're ready, and let's start with Brianna Weeby. She's a master in science and exercise and rehabilitation sciences in College of Health Science, and she was mentored by Dr. Marie Baumet.
Hello, thank you. I am Brianna. I'll be briefly discussing my master's project on the pain assessments as part of a larger study on the functional characteristics of COVID-19 survivors. Like it was said, my mentor on this project is Dr. Marie Baumet, whom I've learned so much from over this year. And additionally, I want to recognize my funding sources. So to begin, what is COVID-19? As many of us know, it's a severe acute respiratory syndrome transmitted by infected respiratory droplets between individuals. There are many symptoms associated with contracting the virus. However, it's the long-term effects of COVID-19 that are unknown, especially regarding the development of chronic pain. Next slide, please. It is important for us to also address the public health disparities that are going on in our own communities, as these issues can be translated to communities outside of Milwaukee. COVID-19 has affected underserved communities by inequitable access to healthcare, along with many other social determinants. For instance, African American residents comprise 26% of the Milwaukee County population, 43% of total positive COVID-19 cases, and 62% of those that have died from COVID-19. Next slide, please. So why study the long-term effects of COVID-19 and why study pain? Well, minimal research has targeted persistent symptoms from COVID-19. Further research is needed to classify the various types of pain, where it's located in the body, and if it impacts everyday function. Next slide, please. My project aims to increase our understanding of how survivors of COVID-19 perceive pain, to classify the types of pain and the impact of pain on their physical function. 3 main pain procedures will be utilized to address these issues. 1, by self-reported pain questionnaires. 2, the impact of pain on function will be done by assessing movement-evoked pain. And 3, by looking at the concept known as conditioned pain modulation, or how our body interprets pain. Next slide. First, participants will complete questionnaires to assess pain sensitivity and to classify the type of pain. The pain questionnaires we use are the McGill Pain Questionnaire, shown on the right, and it is used to identify the participants' current level of pain. Additionally, we have our participants take the PROMIS Pain Intensity Scale, which is shown on the bottom, in 3 questions. The first 2 questions assess severity and average pain while they had COVID, and the last question, again, addressing their current level of pain. Next slide. Movement-evoked pain, or pain with function, is embedded into components of our larger study. Participants are asked to rate their pain before and after activity using a scale of 0 being no pain and 10 being the worst pain possible. We use this scale during the leg strength and fatiguing exercise seen on the left, during breathing function shown in the image in the middle, and during a cycling exercise for aerobic capacity in the image on the right. Next slide, please. Third, we use conditioned pain modulation as a predictor for the development of chronic pain. This is a concept used to assess, again, how our body interprets pain. It's also known as pain inhibits pain. In this, we use what is called pressure pain thresholds, as shown in the image. It's a painful stimulus that's applied to the upper trap and quadriceps, both before and during foot submersion in a cold water bath, which also acts as a painful stimulus. Ideally, what we're looking for here is an increase in pressure pain thresholds during the cold water bath, indicating a normal pain response. Next slide, please.
1 minute left.
So far, in our preliminary findings, we've tested 19 COVID survivors and 6 controls. The data here is only for our COVID survivors, but we've found so far, based on the pain questionnaire, participants rate mild to moderate level of current pain, as well as a mild to moderate level of pain during COVID. With movement-evoked pain, participants have rated mild pain with leg strength and fatiguing exercise and breathing function, but moderate pain with aerobic capacity on the bike. Lastly, we've seen normal conditioned pain modulation at the quadriceps and inefficient conditioned pain modulation at the upper trap. Next slide, please. So what do all these results mean? Well, COVID-19 survivors report minimal chronic pain. Like I stated, there is inefficient conditioned pain modulation in the upper extremity, which can suggest that individuals are at risk of developing chronic pain after COVID-19. And pain intensity should be addressed during movement due to reports of mild to moderate pain. Next slide, please. I'd like to acknowledge my team, including Dr. Sandra Hunter, my mentor, Dr. Marie Piment, and other members. Additionally, a special thank you to our research participants. Thank you.
Thank you very much. Now we move to the presentation of Cassie Labely. She is a biomedical science undergraduate student, biomedical science program, a minor in public health and equity, and she was mentored by Dr. John Mensch, who is now at Medical College of Wisconsin.
Good afternoon. My name is Cassie, as mentioned, and this past year in the fellowship, my discernment was focused on the opioid epidemic through a mentorship with Dr. John Mensch. Next slide, please. Before I begin, I want to acknowledge this team, for without them, I would not be able to give this presentation here today. Next slide, please. The opioid epidemic is a long-standing national crisis with devastating effects on both individuals and communities. Milwaukee is not immune to this crisis, but on the contrary, has been an epicenter for opioid overdoses. There are initiatives that are aimed to reduce the number of opioid deaths here in Milwaukee, one being harm reduction strategies. Harm reduction strategies focus on reducing drug-related harm without the cessation of drug use. My research has focused specifically on the availability versus the accessibility of Narcan. Narcan is an antidote for opioids, meaning it can reverse the effects of an overdose. In Milwaukee, there are numerous Narcan distribution sites, and individuals do not need a prescription to obtain it. However, it is important to note that Narcan availability has not yielded discernible benefit in some communities. When looking at the map created by one of my peers, Amir, it shows the relationship between Narcan availability and opioid overdose deaths here in Milwaukee. Negative relationships, the cooler colors, are those where Narcan availability is associated with fewer deaths, while positive relationships, the warmer colors, are those where Narcan availability is unexpectedly associated with more deaths. As you can see, the relationships between Narcan availability and overdose deaths varied across communities in Milwaukee. Subsequent research conducted by the team has shown that this discrepancy amongst different communities is correlated to racial demographic factors, with Narcan availability showing greater benefit in white communities versus communities of color, therefore showing health disparities. Next slide, please. As equity advocates, my peer John Mendick and I researched more about the barriers that lead to this decreased accessibility. It is important to note that this feedback loop shows what our process looks like right now, but our key findings will likely feed into our first, second, third, and fourth steps. It all began through a partnership with the health department, specifically Courtney Geiger. Our first step was obtaining the opioid overdose death data. Then, through geospatial analysis performed by Amir, he was able to quantify the data into maps, then allowing us to identify communities where Narcan availability was unaffecting them. Through a reporting back to the health department and identifying these communities, it allowed us to address questions, understanding why is this accessibility occurring, and what are the barriers that are decreasing this accessibility. This allowed us to create a partnership with Amy Malinsky, who is a peer support specialist for community medical services. In our conversations with Amy, we discussed the possible barriers that might be limiting individuals. She mentioned that stigma, lack of trust, and decreased diversity in distribution sites may be contributing to these barriers. Next slide, please. And for this slide, I have animation, so could you please click 10 times until there are 5 circles on the screen? Thank you. The first step was a data-driven approach. Using a data-driven approach, we were able to quantify it down and indicate trends in our community. Through the health department, we were able to understand different initiatives and programs that are currently taking place. And through collaboration and research, we can take the steps to increase accessibility throughout these programs. Through a policy-making approach, Alderman Murphy taught us that education is key. When we educate ourselves, informed decisions can be made that will better support our community. It starts with one person spreading the word to end the stigma, just like I'm doing right now here with all of you. Through the City of Milwaukee Fire Department, Lieutenant Miller taught us about trust. We need to work hand in hand with our community to better understand their needs. And lastly, through a peer support specialist, Amy Malinsky, we learned that diversity in distribution sites is needed. Milwaukee is one of the most racially segregated cities in the United States, and individuals and communities tend to stay in their communities because they feel comfortable and they trust their neighbors. Next slide, please.
1 minute left.
As for future directions, we hope to educate, research, and address the needs of individuals in our community, especially during the current pandemic. Next slide, please. Lessons learned from this fellowship program. Though I have learned numerous amounts of things, it all fits into 3 consecutive areas. The first one being availability does not equal accessibility. Though our community has resources, many of them are not accessible due to barriers, and this can be improved through partnerships with community leaders. Recognizing that leaders in our community are not just stakeholders, but they are also nonprofit coordinators, grocery store owners, church leaders, and even students like us. And we need to work together as one. My mentor reminds me that public health research should start in a community and end in a community. And this can only be done through an interdisciplinary approach. We all have our own different expertise and passion, and when we come together as one, we can make giant strides for change in our community. As for my personal and professional path, this fellowship has shown me I have a profound passion for public health research and policy. I hope to be able to carry both of these things with me as I take on a healthcare provider role one day. I want to take a holistic and interdisciplinary approach into my future career. Though this fellowship has given me multiple pieces to my puzzle, I know it's created a leader in me, taking me to my next step, which is the Accelerated Master's in Global Health Equity at the Medical College of Wisconsin. Thank you for your time.
Perfect time for both presenters so far. Thank you very much. That makes my job easy. So next we have David Brocky. He's a biomedical science student, and also he's in the Master in Science in Exercise and Rehabilitation Science, and he was mentored by Dr. Sandra Hunter.
Thank you for the introduction, Dr. Martins, and thank you all for coming. Over the past year, I've had the privilege to work with an excellent team of researchers from a wide variety of disciplines at both Marquette University and Concordia University of Wisconsin to investigate how COVID-19 has impacted students studying the health sciences. Next slide, please. The COVID-19 pandemic has had a huge impact on everyone, particularly though on healthcare workers. Study in August, physicians found that 37% would like to retire in the next year. If even a quarter of them follow through with that intention, that'll be over 100,000 physician jobs that need to be filled, not even including nurses, PAs, etc. So to meet this demand, we need a new wave of healthcare workers. And that's dependent on a new wave of committed, passionate health science students. But the pandemic has been very challenging on college students as well. So our study was aiming to look at our health science students to find out how their physical activity, mental health, and career commitment have been impacted by the pandemic. Next slide, please. So to do this, we sent out an online survey during July and August. It was completed by 297 students. They answered questionnaires about their levels of depression, anxiety, physical activity, their perceived coronavirus threat, their commitment towards their intended health science career, as well as some demographic questions. Next slide, please. So of the respondents, it was about 70% from Marquette and 30% for Concordia. It was a predominantly white female makeup, but that is really representative of health science programs at both universities. And the age range was a wide range from 18 to 42, but most were around 21 years old. So what we expect from the sample. Next slide, please. There were many important findings from this study. Levels of clinically significant anxiety and depression were both around 30%, and this had a strong correlation with low career commitment. It was also much higher in female students, which indicates that they've been particularly impacted by this pandemic. And then lastly, 11% of respondents expressed that their interest had changed due to the pandemic. Next slide, please. And students had a chance to express some of the reasons why their interest had changed. And we had a lot of different reasons selected. Some were particularly common. Online learning, ability to make a difference, ability to secure clinical placements were all selected by a majority of students who expressed their interest had changed. So that's been a huge issue. And mental health, health risks, finances, and family pressure were all very big factors. Next slide, please. So there's a potential for a big impact from the study. Knowing this information will allow universities to target their response to the pandemic to specifically address this crisis. There's great opportunities for counseling services, career services, and academic programs to modify how they conduct their operations and try and help these students through this challenge, particularly with how they conduct online learning, as that's been a big factor in some of these career issues and mental health. Thank you.
Thank you, Dave, very much. You still have a minute left. So next is Gina Natakunda. She's a master in science student in clinical mental health counseling and MBA in health. She was mentored by Dr. Alexander Martins.
Right. Thank you, Dr. Martins. Yeah, so as I've been introduced, my name is Dina Natkunda, and yes, I'm a student of clinical mental health counseling here at Marquette, and I have an MBA in multi-healthcare management. Much appreciation to you, Dr. Martins, and to the CEO of St. Camilla's, who gave me a chance to evolve in research at St. Camilla's residency. Next slide. Thank you. So in this public health and equity fellowship, I viewed COVID-19 in the elderly, in the long-term care facilities in three perspectives: the public health perspective, the equity perspective, and the social justice perspective. In the public health perspective, I looked at older persons being 65 and above. That makes them vulnerable, and they have decreased immunity, and they risk infection, severe illness, mortality due to COVID-19. This older age group has also been affected by unintended consequences of public health interventions, such as social isolation from their families, other support groups, which could affect their mental and psychological health. Then in the equity perspective, therefore, during the allocation of the initial doses of COVID-19 vaccines, older persons were prioritized along with the healthcare personnel, and they are placed in the phase 1A of vaccinations. Looking at the social justice perspective, we know that the interaction of age with chronic conditions, poverty, race, and other vulnerabilities makes it a significant contributor to mortality. Elderly persons could suffer the systemic injustices that have for long affected society. Next slide, please. Yes, so I engaged in a number of fellowship activities. which made me better understand these three perspectives. I reviewed the literature that included the peer-reviewed journals, the reports about COVID-19, and the elderly persons living in long-term healthcare facilities focusing on Wisconsin. I also had more than 100 hours of practicum experience at St. Camilla's residence for the elderly. And then I was able to facilitate a workshop on COVID-19 and long-term care homes, where we were honored to host the CEO of St. Camilla's as our guest speaker. It was an interesting one, where we all learned. Next slide, please. Yeah, so as you can see from the graph, at the peak of the pandemic in Wisconsin, about 170 residents died in 1 week of COVID-19, according to the federal data. But from the literature and from my observations, several interventions have been helpful, including vaccinations, personal protective equipment, counseling and sensitization, hygiene, and thorough cleaning for infection control, among other interventions. Next slide, please. Yes, so here is my personal reflection. The public health—
1 minute left.
Yes, please. The public health fellowship has been a great opportunity to learn and engage with a multidisciplinary team of fellows and mentors about COVID-19. Health equity applies to vulnerable groups regardless of their race. Inequities enhance public health challenges. And finally, public health embraces the art and the sciences to explore, but also solve challenges as seen in the COVID-19 pandemic. For the next steps on the next slide, I hope to submit a paper for publication, and I plan to continue utilizing interdisciplinary approaches in my educational, healthcare management, and clinical mental health career path. Thank you all, and thanks for the opportunity.
Thank you very much. You guys are very good on time. That's very great. I should make my job easy. The next is Emily Beltran. She's an undergraduate student major in psychology and biology in the College of Arts and Science, and she was mentored by Dr. Dora Clayton-Jones.
Hello. As Dr. Martin said, I'm Emily. I'm one of the Master's in Nursing students, and so I worked with one of the nursing professors, Dr. Dora Clayton-Jones, and we looked at COVID-19 in young adults that have sickle cell disease, and we used a photo voice-based method, which I'll explain what that is. Do you want to go to the next one, please? So this is photo voice. Basically what it does is it allows a group of people to express themselves through photos and kind of strive for change in a community. So it really fit well with this public health and equity idea. And basically what it can do is it allows you to record your community's strengths and weaknesses in your own pictures and then express them and kind of what you think about them. So it promotes dialogue, and then it allows you to reach policymakers at photo exhibits once you have a whole completed study of photos. And then at those exhibitions, you can advocate for social change and action. And so basically we encouraged our participants to educate society, pick an issue to highlight, and encourage action at our exhibit, which will be in June. Next slide, please. So our project included 9 participants that are ages 18 to 35 that have sickle cell disease, and they are all across the United States, and we meet weekly on teams throughout January to June. And each week, the participants chose a topic of what they would like to photograph. So just an example of one was challenges that these sickle cell young adults had during COVID-19. Another one they chose for 1 week was the positive aspects of their lives during COVID-19. Another one was relationships. And each week they took photos then, and then we would come and discuss their photos. And we had a professional photographer that helped them kind of look at how to take good photos and then how to edit them to best express their feelings. And then to discuss these photos every week, we used the showed response method, and we would ask questions, and they would basically respond to them and say, what do they see here? What's really happening in your photo? How does it relate to your life? Why does this strength or concern exist? How can this image educate others? And what can we do about it? So that was kind of facilitating them to start thinking about change. Next slide, please. So here's an example. This is one of our participants, and this is a little bit of her story, just a sneak peek of kind of what will be included at our Photo Voice exhibition in June. So this was her caption with the photo. So each time they take a photo, they also write a caption. And she says, sickle cell can be hard and lonely at times, but your inner strength can turn a dark night into a bright morning. And this was taken during our project and kind of the impacts of COVID on her life. And the picture on the right is her during a sickle cell crisis. Next slide, please. So how the fellowship has impacted me. I've gotten great relationships with my fellows and professors, and being a first year master's student at Marquette, it was a really great way to build connections. Learned a lot about the effects of COVID-19 specifically in like the more disadvantaged populations. We've had some really great talks every week in our journal clubs, which has been awesome. I was able to attend a conference with Dr. Dora Clayton-Jones. The journal clubs have been really helpful, and it's really spiked an interest of mine in public health, which I didn't really know I had until this fellowship, so that's been awesome. And I'd like to invite you all to our photo exhibition. It will be on Zoom on June 18th at 6 p.m. where all of our participants will present their work, and we'll go through kind of and have them share their stories, and we'll have a presentation. So if you would like to be invited to that, I can send you the link. And thank you so much for listening.
Thank you, Emily, very much. Now my colleagues, one of you introduce the others.
So our next presenter is also called Emily. It's Emily Effington, who is also another one of our master's students in nursing. And she is mentored by my colleague in nursing, Dr. Abiola Keller.
Hi, everyone. Thank you so much.
She's really only a sophomore and she's doing this great.
Yeah, thank you. Actually, I sent updated slides, but that's okay. So this is my older slides, but it has the same information on it. So as I said before, my name is Emily Effington. I am a sophomore at Marquette's College of Nursing, and my mentor was Dr. Abiola Keller. And today we'll be talking about caring for the caregiver qualitative analysis event. Next slide, please. So this event, Caring for the Caregiver, was formed because African American caregivers are a critical group of caregivers. African Americans have a higher prevalence of family caregiving. They spend more time on caregiving. They assist with more activities of daily living than white caregivers. And African American caregivers are most likely to report risky health behaviors and are less likely to report being in good health than white caregivers. And so promoting self-care is a top priority in the national agenda for supporting family caregivers. And today, I will be talking about how this event supported African American caregivers to engage in actions that promoted their health and well-being. And so a virtual Caring for the Caregiver program took place in Milwaukee, Wisconsin, where 16 African American caregivers attended virtually in 2020. And I was able to analyze a survey that was sent out to participants after attending the event, asking about what they thought about the event and any input they wanted to express. Next slide, please. So some of the methods that were used was organizing the participant responses in the Microsoft Excel sheets. I was then able to identify the main ideas in the participant statements. And after that, I condensed these similar statements into key themes. And while doing this, I was able to sum up what qualitative method of content analysis really was. It is quantifying and analyzing the presence, meanings, and relationships of such certain words, themes, and concepts that these participants responded to. And so on the right, there's some example questions that were analyzed in the Excel sheet. The first question the participants were given were, describe how this event had met your expectations and or needs. And the second question was, describe how this event was helpful or not helpful. Next slide, please. The results, one of the main themes was not alone. So for the first question, describe how this event has met your expectations or needs. The first response we got was, the workshop reinforced that I am not alone in this struggle. And another response that also supported the theme not alone was, enjoy the great group of women who are experiencing what I was also experiencing. In the second question, describe how this event was helpful or not helpful. We got responses such as, helpful to have a place to come together. Another response was helpful to have people who have or are experiencing the same things as you. And another response that also helped was helpful knowing that I am not alone. Next slide, please. Additional themes that emerged from the qualitative analysis besides the theme not alone included the theme social interaction. And that was helpful just by having the opportunity to be with other caregivers was a response we got. The theme learned something. And a statement that supported this was, it gave participants more tools to use to care for oneself. And the theme resources, where they were provided for the caregiving needs. Next slide, please. Additional themes were also self-care, by helping the participants relax and focus on oneself. The theme information, by giving more tools the participants were able to use for caring for oneself. And the theme yoga, that provided a new activity for some participants that they have always wanted to try, but just never had the time for themselves to focus and relax on themselves. And so yoga was another thing that many participants loved and loved trying for the first time. And so I just wanted to thank Dr. B for giving me the opportunity to work alongside with Dr. Keller in her research, Caring for the Caregiver event. I was able to come away knowing what the qualitative analysis is and the methods on how to create these key themes through this process. Thank you.
Wonderful. It looks like I will not ruin Alex's streak. I can tell you guys have really prepared and practiced for today. Our next speaker is Julia Jezikowski. Please correct my pronunciation of your name. And she is one of our students majoring in biochemistry and molecular biology, and her mentor is Liz Angeli.
Thank you. You got it right, actually. Yes, I am Julia Jezikowski. I'm a third-year undergrad studying biochemistry, and I worked with the lovely Dr. Angeli, who's a technical communications professor in the Department of English. And we worked especially with the EMS system in southeastern Wisconsin. I personally am a licensed and certified EMT, and Dr. Angeli was previously. Unfortunately, her license has expired, but she still has plenty of EMS knowledge. Next slide, please. And so we tackled 3 projects dealing with the qualitative research of EMS care reports. Our first project was a nationwide survey that we sent out to providers all across the nation, asking if their EMS training aligned with the expectations of their jobs. And in the survey, we included asking them questions from their technical standards, like how well do they think they can perform CPR, to asking if they feel that they can deal with mental health emergencies and provide care with compassion. Our second project looked at interviews that Dr. Angeli performed with several different healthcare professionals from medical directors of emergency departments to a prosecutor to a district attorney. And we looked at what report readers look for in a well-written report. And for this, we used grounded theory and in vivo, which is a coding software, and we developed a coding scheme to find out what exactly is in these interviews that report readers are looking for. And our third project is ongoing, and it's a narrative analysis with Diction, which is another type of report reading and qualitative research, looking at the narratives of healthcare reports and if details are improved when writers are given guiding questions when they're filling out reports. If they're asked specific questions, will the details of the report improve? Next slide, please. This is a sample coding comparison from the in vivo software. As you can see on the left there, we have our set of codes where we had 4 big sections. We had scene details, patient details, care details, and report credibility. And this specific section here is looking at a sub-code, which is clarity. And in the green, those are places where both myself and Dr. Angeli coded the interview for importance of clarity. And up on the top there, we looked at a little bit of quantitative with kappa scores, which are how much did different raters agree with the coding schemes. And so overall throughout our project, our kappa was around 0.31, which is a fair correlation. Next slide, please. Key accomplishments during this fellowship, we had received around 900 total responses for our survey, which we were not expecting that many. So we're really grateful for all of our responses, and the results are pending. For our project with in vivo, I presented at the undergraduate research section at the college composition and communication conference in March with Dr. Angeli's support. And our main findings were that report readers are looking for justifications for the provider's actions, especially if there was deviation from protocol, and they're looking for details about the patient and especially about their assessments to further facilitate patient care when those patients get into the emergency room and nurses and doctors need to take over. Do they have all of the details for facilitating that patient care? And our project with Diction is our newest project, and so that is still ongoing, and we do not have any results from that yet. Next slide, please. The biggest lesson that I've learned from this fellowship is that healthcare research is incredibly interdisciplinary. I'm a biochemistry major and my mentor is in the Department of English, and that is not a common pairing, but that is how the nature of healthcare research has grown, and it does not have to be quantitative. And I will continue to work with Dr. Angeli during this summer, planning for publications and a presentation to our firefighters and paramedics at one of our research sites. And the impact on my own report care writing is that I now have the knowledge of what is a good report. And I look forward to being able to help facilitate patient care when I am working. Thank you.
Thank you. It's all such impressive work. Next, I'd like to invite Karina Miller to give her presentation, and she is a student studying clinical laboratory science, and her mentor is Dr. Neil Lode.
Thank you. Hi, I'm Karina Miller, and me and Dr. Lode worked on a project to understand public perception regarding COVID-19 health messaging. If you go to the next slide, please. If you click again, there should be a quick video. This was the video that was sent out with Penn State when they did the nationwide survey, and you can play the video now. And you can go to the next slide. So we did a research survey, which was originally headed by Penn State, and then the Medical College of Wisconsin, UW Milwaukee took over, and me and Dr. Lode, and we did one in Wisconsin to understand the compliance with COVID-19 guidelines, to identify the preferred information sources, and to assess the trust among Wisconsin residents. The reason for this project was so that we can lead to better preventative measures in the future. We asked questions including COVID-19 knowledge and common safety measures, and we analyzed trust in government, healthcare providers, and the trust in the vaccine was also analyzed. Next slide, please. The two main research questions that we focused on were if there was a correlation between having a college degree and believing in the severity of COVID-19. And the second question was if people who go through a healthcare profession education program are better equipped to understand the short and long-term impacts of COVID versus someone who is not. Next slide, please. So for our method, we sent out two different surveys, and they were both done at the beginning of the pandemic. And the first wave was a longer survey with less respondents, and the second wave was 526 respondents, so that one had more, and there were less questions. We broke the results down by county along with Milwaukee City versus Milwaukee County, and we found that Milwaukee City and Milwaukee County and Dane County, which houses Madison, had the most respondents. Next page, please. Our results revealed deep hesitations about vaccine hesitancy among the African American community in Milwaukee. This was seen before the vaccine was even talked about. It was at the beginning of the pandemic, it was already seen that if there were a vaccine, they would be hesitant about it. And there are many past social issues and reasons why that will be. Another result of importance was that hearing the changing information about the virus has caused hesitancy. As we were learning and updating more about the virus, it obviously changed the public picture because we were going with it, and the changing information has skewed a lot of people away from trying to understand the virus and trying to get it under control. We also had a strongly educated group of respondents. Most of them took COVID-19 and the vaccine seriously. And we also found that the most trust lies in local healthcare providers and the CDC. Next slide, please. These are our result tables. The table on the left was African American community only in Wisconsin. And as you can see, there was a lot of strong disagreements that they'll be likely to get the COVID-19 vaccine when it becomes available. And the graph on the right shows where people's trust lie, and this is through all respondents. And this shows that most of the trust lies in personal healthcare providers and the CDC. You can go to the next page, please. So in conclusion, we think we oversampled academics, professionals, and whites, and this could be because of the survey was done on social media and through the internet, which even though it is 2021 and we like to think that that is far-reaching enough, it isn't, and that was proven in this study. We learned that misinformation infodemic was going along with the pandemic, which is a learning opportunity for the inevitable next pandemic that we're going to endure, and the ways we can communicate between the science people and the general public and making the understanding even there. We also saw that we had less people of color respond because of lack of representation in the healthcare field. This highlighted that the healthcare field is mainly white, and we need to find a way to include more diverse voices, especially in positions where it's taking the health of everyone into consideration. Next slide, please. Thank you all for attending and listening to my presentation.
Thank you for making the presentation, Karina. Our next presenter is Madeline Gwynn, and Madeline is studying biomedical sciences, and she is one of the minors in public health and equity in our very first cohort. And her mentor is Dr. John Manch.
Hi, as previously stated, my name is Madeline Gwynn, and today we'll be discussing the accessibility of support for opioid use disorder in Milwaukee. As said, I'm a junior majoring in biomedical sciences, and my mentor is Dr. John Manch. Next slide. So here's a picture of my research team that I've been meeting with once a week, and I've created another learning community with. Next slide. As an introduction, we'll be addressing the questions on display here. And in the opioid crisis, Milwaukee is at the heart of many overdose deaths. It is an example of a city with many hotspots linked back to health disparities faced by community members. Next slide. My approach to answering those questions are linked back to the approach I've taken with the support of my research team. Through the learning community we formed, we were able to have speakers join conversations in our weekly meetings, working with data scientists and community stakeholders. In order to do so, our research team were able to maintain the integrity of our research by building connections. From those discussions, I was able to glean valuable information to support my central question of why is there a disconnect between resources for treatment and Milwaukee County community members receiving the support. Working with Bree and my research team, I was able to apply my knowledge to the fellowship learning community. From there, I was able to utilize my colleagues as resources and guidance through reflections and guest speakers. So on the right, we have a map, and it's a heat map of Milwaukee County displaying the opioid use disorder treatment centers, which are located compared to the opioid overdose death hotspots. Where there are a few treatment centers within a hotspot, the disconnect between an OUD treatment center being present in a high opioid overdose death zone is clear. And so all the maps you'll see here are credited to Amir, who is a person on my team. Next slide. Comparing where the service areas are in Milwaukee County to the opioid overdose death rates to treatment centers. A service area is calculated based on a bus stop and 1.5 mile distance from it. On the left, the majority of OUD treatment centers are in close proximity to high overdose death rate areas. However, there are still large zip codes that do not have many or any OUD treatment centers, as can be seen in the center and the upper right zip code. Shifting then to the map on the right, the purple zones represent the service areas, which means if there is a red still present, there's a high overdose death rate in an area not within 1.5 miles of a bus stop, which could be used to reach a treatment center. Connecting the two maps together, the gaps in transportation can be seen as a possible cause of high overdose rates. Next slide. At the conclusion of my research, there are still many questions and positions of growth I hope to have. I was able to come to a presumed result that high opioid overdose death rates having one contributing factor being accessibility, as seen in the comparative maps on the previous slide. Through my conversations with several community leaders, I was able to gain more insight on the community resources present while assisting me in answering my central question. Going forward, I hope to continue my conversation with other community leaders alike and grow my understanding of the problem and presence in working towards a solution. Next slide. My goal for my research and desire for impact on the community is linked back to the availability of sustainability and the growth of community without my assistance after a time of direct support. My timeline for sustainability includes 3 aspects: grow, learn, and empower, all equally connected to one another. First being to comprise a comprehensive list of community resources while growing a relationship with people in the community. Next, to continue conversations to better understand the cycle and the individual situations. But we're also building a framework for the conversations to be continued on in the future by others. Which leads me to my last point of building up community resources and strengthening community leaders, bridging the gap between the two. Next slide. Throughout this year, I've been able to grow in many aspects of my life, and the Public Health and Equity Fellowship is to credit for the majority of it. It has specifically impacted my life through interdisciplinary approaches, sustainability, and partnership. Through having weekly meetings, I've been able to obtain the value and the need for having many voices involved in the decision-making concerning the empowerment of others. With this precedent established in my approach, I was able to utilize both my research team and fellowship colleagues to grow and develop. Leading to my last point, I was able to understand the need to maintain sustainability and trying to impact community members. I was seeking to avoid a Band-Aid fix, but rather build up and support community members through engagement. Finishing with my final thought, though the relationships built through this fellowship, I was able to take away the importance of working together with colleagues and the unknown value others can have on your ideas. Additionally, through my research with Dr. Manch, I was able to see the value in working with community partners to accomplish a goal together and having a stronger impact by being on the same team as opposed to tackling the issue alone. I hope to continue this effort as I shift my education in the fall to join the Accelerated Masters in Global Health and Equity program at Medical College of Wisconsin as I continue my goal of becoming a healthcare provider. Thank you so much for listening, and that concludes my presentation.
And our last, but certainly not least, presentation is going to be Natalie Rowe, who is another one of our students studying biomedical sciences, and her mentor is Dr. Joseph Bionanebie.
Hi everyone, my name is Natalie Rowe and I'm a senior studying biomedical sciences. My mentor for this research project was Dr. Joseph Bionanebie, and we chose to focus our research on COVID-19 and the church. Next slide, please. Overall, we focused our research on practices, impact, and response to overcome COVID-19 by the church in North America. With that, there are many considerations. First of all, it's important to recognize that religious and spiritual interventions provide hope, acceptance, healing, and rejuvenation, especially in times of high uncertainty like the COVID-19 pandemic. However, while gathering in communities of faith can relieve anxiety, COVID-19 poses some challenges to do so in a safe manner. Obviously, like I'm sure you're familiar with by now, there are many restrictions that COVID-19 imposes on our daily life. With that being said, we aimed our research to answer the question of how can communities of faith gather safely? With answering that question comes exploring the role of the churches in preventing the spread of infectious diseases and promoting overall health and well-being in seasons of outbreaks. Our main focuses for writing our paper were 1, identify church practices that are likely to increase the risk of COVID-19 or other infectious diseases. 2, identify church practices that help to prevent disease and promote well-being. And 3, identify modifications that can be made by the church to prevent the spread of COVID-19. Next slide, please. Our primary method of research was a literature review. We explored electronic databases and analyzed peer-reviewed journals to find information for our 3 main focuses, which I previously listed. In addition to conducting a literature review, Dr. Bionanebie is a part of a COVID-19 task force for Elmbrook Church, so we attended meetings to discuss restrictions and how they relate to the safety and health of congregants. This task force included members of church leadership, medical doctors, and public health professionals. Finally, through our fellowship, workshops and journal clubs were held bi-weekly. This allowed for me, as well as other fellows, to learn more about research in general from mentors and other speakers. In addition, we held open conversations discussing how health in the time of COVID-19 can be impacted by inequities within the realm of social justice. Next slide, please. Our literature review concluded many findings, some of which are outlined on this slide. Here you can see the identified risk factor in bold with the recommended safety guideline listed below the bolded text. For every decision made, churches must take into account and not compromise biblical truth, church values, scientific evidence, public health guidelines, ethical morals of the society, and most importantly, the safety and religious needs of its congregation. The church, therefore, has a religious and moral obligation to protect its people as well as maintain a church that doesn't contravene the commandments of God. Therefore, it's essential that these decisions are thoughtfully considered and made, and a balance must be struck between church values and public health requirements. One of the greatest limitations and challenges that we faced was limited research on the church's role and impact in preventing infectious diseases. Therefore, more research moving forward would be beneficial to ensure the health and safety of congregates gathering in communities of faith, especially in times of outbreaks, epidemics, and pandemics, is maintained. Next slide, please. This fellowship and research opportunity was truly a one of a kind experience and was so special to me. There are so many skills and lessons that I learned, but broadly I learned the importance of research and the power of collaboration. In terms of research, I learned how to appropriately research, write, and format a manuscript. Currently, Dr. Bionanebie and I are working on submitting our manuscript for publication. As for collaboration, I learned the importance of strong communication from task force meetings with an interdisciplinary approach. Open communication and strong teamwork is what ultimately leads to enforcing COVID-19 guidelines and keeping individuals and communities safe. Finally, personally, my next steps include graduating in about 2 weeks And after graduating, I'm taking a gap year to do a year of service through AmeriCorps focused on maternal and child health. I'll be moving to Arizona, where I'll be living and serving in a shelter for women who are pregnant, parenting, and experiencing homelessness. From there, I plan on becoming a PA while maintaining high interest in public health. Next slide, please. I'd like to thank Marquette and all who made this fellowship a reality. From the bottom of my heart, I'm so appreciative to have had this opportunity to conduct research and grow in my experiences in public health. I'd especially like to thank my wonderful mentor and friend, Dr. Bionanabier. Thank you for teaching me, challenging me, believing in me, and continually pushing me to be the very best person that I can be. If you have any questions about our research or my presentation, feel free to email Dr. Bionanabier or me. Thank you.
Thank you, Natalie. That was an amazing array of topics, research represented, and just fantastic presentations. I really want to congratulate all the students for their input and the hard work and the obvious lessons and growth that have occurred over the last year or so. My name is Dr. Sandra Hunter. I'm a professor in exercise science in the Department of Physical Therapy. I'm also director of the Athletic and Human Performance Research Centre. And I'm here to thank and also introduce Dr. John Su, who is Vice Provost for Academic Affairs and who will present the students with their certificates. And we want to thank Dr. Su for supporting this initiative through the Wade Klingler Teaching Enhancement Award that resulted in the Public Health Equities Minor. So thank you, students, thank you, mentors, and thank you, Dr. Su. Over to you.
Great. Thank you, Dr. Hunter. Thank you all for letting me join you today. What powerful presentations from our fellows. I think you all remind us why public health equity research is so crucial at this moment for us as a Catholic Jesuit institution at the heart of Milwaukee. So I'm so deeply appreciative and just impressed by the work you fellows have done. I'll announce all your names shortly, and the certificates are being mailed. It's like the check is in the mail. But before I name the fellows, I love the language of a community of practice. I think COVID has taught us more than anything else how powerful community is for sustaining all of us and for our research. And so every community depends on mentors. So I'm asking you all to join me in applauding our 9 mentors, Drs. Marie Beman, Dr. John Manch, Dr. Sandra Hunter, Dr. Alex Martins, Dr. Dora Clayton-Jones, Dr. Abiola Keller, Dr. Liz Angeli, Dr. Neil Lode, and most especially our community of practice, Master of Ceremonies, Dr. Joseph Bionanabier. Thank you, mentors. Wonderful, wonderful. And so I'll just name one last time. I'll kind of walk through our fellows, just to name you all again and just congratulate you on your wonderful work. So Brianna Wabier, Cassie Labley, David Ruck, Dina Natakunda, Emily Beltran, Emily Effington, Madeline Gwynn, Natalie Rowe, Karina Miller, Julia Jezikowski. Congratulations and thank you all.
Right. Thank you, Dr. John Su, for that amazing conclusion. We always like to end on a good note in our fellowship. Thank you for your presence and for the leadership at Marquette, together with Dr. Jane Hossein, who was able to speak before. And we appreciate all the guests who came in from all over the world. We appreciate our keynote speaker, Dr. Jesse from Medical College of Wisconsin. We appreciate all of you, the fellows. We appreciate you, all the mentors. We appreciate you, the family. We are Marquette. That's who we are. And thank you for this time that we shared. And here ends our event. I wish we were in person, then we would have some, I don't know what kind of party celebration, but thank you so much for coming in. And a special recognition of Dr. John Mantz and Dr. Neil, Dr. Alexandra, and all of the other mentors who initiated this, this kind of work. I remember at the beginning of the pandemic when we were wondering, how do we move forward this kind of initiative? And they made it happen. Thank you, everyone. Thank you. Thank you so much.
Thank you, Joseph.
Thanks for your leadership, Joseph.
Thank you. And behind the scenes, we have been having a special person, Kat. She's been moving forward all the artwork, all the slides. So we've been having a team of people working in the forefront and behind the scenes. Thank you, Kat, for your work.